Hello, I'm Logan Hubbard. I'm a PGY4 urology resident at Houston Methodist Hospital. Today I'm going to take us through our baseline MRI findings of gray and white matter contributions to lower urinary tract symptoms in men with BPH and bladder outlet obstruction. Relative disclosures are listed here. BPH, or benign prostatic hyperplasia, can affect the entire micturition cycle, including the storage or filling phase and the voiding phase. Work done in the past by Steers and his colleagues has shown that persistent bladder outlet obstruction is known to remodel the bladder's smooth muscle, connective tissues, and local neural network. But despite his seminal work, the extent to which bladder outlet obstruction alters the central nervous system in these patients is still largely unknown. This represents the first study in humans to evaluate the alteration in higher neural activity and structural connectivity during the bladder cycle in men with BPH and bladder outlet obstruction. Men with BPH over 45 who plan to undergo bladder outlet obstruction procedures were recruited and underwent a concurrent urodynamic and functional MRI testing platform, pictured on the right here. MRI-compatible catheters and tubing were passed through a small opening in the wall between the control room and the scanner room, depicted on the right. Subjects' bladders were filled until they signaled a strong desire to void, after which they were allowed to void in the scanner. This cycle was then repeated 3 to 4 times as depicted to ensure robust neuroimaging data was obtained, and urodynamics were recorded concurrently during the fMRI analysis. A 3 Tesla MRI was used to gather functional MRI images, and significant activated voxels were identified at strong urge to void, voiding initiation, and/or patient attempts to void. Additionally, white matter tracts were also interrogated using MRI techniques, specifically called diffuser tensor imaging tractography. Commonly, this is used to study axonal white matter organization in the brain. 2 DTI parameters were used in our study: fractional anisotropy and mean diffusivity. These terms describe the pattern of proton flow in the brain, and the integrity of white matter tracts can be evaluated based on these 2 parameters. So for example, the closer the value of FA is to 1, the more unidirectional protons flow is, or the flow that protons have along a single axis in the direction of the axon. This can be seen depicted in the diagram below. Mean diffusivity is the opposite in that small MD values represent unidirectional diffusion of protons along the axon, which indicates healthy axonal tissues. After exclusion, 7 men with a mean age of 61 were evaluated with baseline demographics represented here in Table 1. Brain activation patterns can be visually represented here in Figure 1 at full urge and voiding initiation. In this pictogram, the red is depicting activation and the blue is depicting deactivation of those regions. Only significant activation was reported, and its strong desire to void, there was neural activation in the right inferior frontal gyrus seen in Figure 1A. Significant deactivations can be seen depicted and summarized below. Of note, only 4 of the 7 patients were able to void supine during the initial fMRI scan, but during initiation and voiding attempts, there were actually several deactivations of important regions, including regions that have been known to be activated with increased bladder sensation, such as the bilateral thalamus, the insula, or regions known to be activated at voiding initiation, such as the inferior frontal gyrus. The DTI analysis, based on the FA and MD, as I described earlier, revealed multiple white matter tracts with statistically significant association and association with objective and subjective clinical parameters. There were 8 tracts associated with Euroflow parameters, Qmax, PVR, and Qmean. Amongst these tracts, there were 2 tracts from top to bottom on the right that were the middle cerebellar peduncles and the left medial lemniscus that were associated with Qmax. 1 tract on the left posterior corona radiata was associated with PVR, and 5 tracts were associated with Qmean, depicted on the bottom right. There were an additional 17 total tracts which showed significant association with the validated questionnaire IPSS score. So we found that many of these tracts have been known to be involved in bladder control, projecting to and from regions that are known to be important in bladder function, such as the thalamus, the brainstem where the pontine micturition center is located, and the prefrontal cortex where the centers for executive function and control are located. Any damage in these tracts, therefore, postulated could lead to impaired bladder function and residual voiding symptoms that are seen in patients post-outlet obstruction. So taken in whole, these findings are exciting and suggest that both the local and the central nervous system can undergo structural and physiologic changes in response to chronic bladder outlet obstruction. Further studies should evaluate whether these parameters or patterns of cortical deactivation and activation, as well as structural connectivity changes, reflect neuroplastic changes in the areas of supraspinal micturition control in response to chronic outlet obstruction in men with BPH. These gray and white matter changes potentially may serve as baseline predictors for successful responses to bladder outlet procedures, bladder outlet obstruction procedures, and or as a foundation for new novel therapeutic technologies that are aimed to try and improve functional and structural connectivity of the brain in this population. And with that, here are the references. Thank you for your attention, and I'm happy to answer any questions.